want to welcome everyone to the governor's office. I think this is an important day for our state and our budget. During my budget address a couple of months ago, I talked about the need to rescue our Medicaid program in Illinois. Medicaid is a program, a health program. It deals with 2.7 million people. More than half the births in Illinois of children born are done on the Medicaid system. It's a vital system. It's very, very important to our state, and we have to make sure that it is here today and here tomorrow. And so I said we had to work night and day in order to restructure the program. Last year, the expenditures of Medicaid were $1.9 billion more than the revenues for Medicaid. That's nearly $2 billion of bills of Medicaid from last year coming into the new fiscal year. So we could not continue at this pace. The Civic Federation, which has done a rigorous study of the program, found that if we did not restructure the program, that in 2017, 5 years from now, the bills would be $21 billion. And we just can't afford to do that. The system would implode, and it would eat up everything in state government. We have important priorities in state government. Education, I was with some students this morning. Public safety, that's something we always have to be cognizant of. And those priorities are as important as health care. And so we have to balance our priorities. So I commissioned a work group made up of representatives and senators of both parties in both houses. And they came together and have worked under the leadership of Julie Hamos, our director of our Health and Family Service Department. And I want to salute Julie Hamos for doing an outstanding job. Talk about an outstanding public servant. Day after day, week after week, worked with the members of the working group and other members of the legislature who wanted to come by and learn about the issue, to come up with a menu of reductions and efficiencies, cuts necessary in order to restructure and stabilize the system. It wasn't easy, it was very difficult, but necessary in order to save the system, to rescue the system, to have a system of health care for our most vulnerable residents all across Illinois, 2.7 million people, lots of them children. We have to make some fundamental changes. Now, these are difficult changes, but if we don't make those changes, we won't have a system at all. So it's very, very important that we understand that at the outset. In our work group, I'm very proud of their efforts. They did their very best. They identified a number of areas of economy. I think there were 58 separate items where there are either reductions or cuts or efficiencies that we're going to be proposing to both houses of the legislature. And the savings amount to about $1.35 billion, a significant amount of money. But we have to do more. We have to ask our providers, those who are involved in the healthcare system, to tighten their belt. And we are doing that by asking them to make economies of $675 million. Total of cuts, efficiencies, and reductions to the providers are about $2 billion. That's a significant amount of money. Now, there's a big health care issue in Illinois that's afflicted many citizens of our state for many years, and that's smoking and cancer caused by smoking and other tobacco-related diseases. We've worked with the American Cancer Society, which has pointed out that one of the very best ways to reduce Medicaid costs now and in the future, and we want to have a program that deals not only with today, but stabilizing our Medicaid program for years to come so that it is sustainable. And one of the most important ways to do that is to deal with the issues of tobacco-related disease. This is something that is a very large cost driver in our Medicaid system and has been for some time. Now, we could stand on the side and do nothing about it, but there's a proven strategy that has worked and will work in Illinois at reducing smoking, especially by young people, and that's to raise the price of cigarettes. I think the people of Illinois understand that it's important that we have healthy people especially healthy young people. And in order to prevent young people from smoking, price of cigarettes is a key issue and variable. So we're going to raise the price of cigarettes in Illinois by $1 a pack in order to get revenues that we need for our healthcare system, about $337 million, something like that. And the extra bonus that comes with that is that allows us to get federal matching money of $337 million. That is something that we should not pass up. I think it's a very important ingredient in a healthcare program in Illinois to reduce smoking, reduce the costs related to tobacco, and also get federal money, matching money of hundreds of millions of dollars to help us pay our Medicaid bills. So this is a balanced approach. It starts, number one, with preventing fraud and abuse. We don't want anybody in the Medicaid system that isn't eligible for the Medicaid system. So there's some very strong, tough safeguards here that we want to work together with the legislature and everybody in Illinois. If someone's not eligible, they don't belong in the Medicaid system, and they'll be taken out. And there's significant reforms in our package to carry that mission out. There are also, I think, very strong efforts to switch from a fee-to-service system in Medicaid that isn't always based on outcome and more on provider payments to a wellness system based on coordinated care. We want to make sure that those who are in the Medicaid system are focused on health and wellness and prevention. And so our coordinated care system will be accelerated. It's very important we do that. And we also want to make sure that we get every single dollar we can from Washington for any kind of investment in health care. So that's what our plan is all about. It's designed to make sure that we reform the system, restructure the system, have a balanced system, maintain the system for the most vulnerable people in our society who need health care, but at the same time understanding if we don't rescue the system today, it will get worse day after day. If we don't deal with this problem right now, it'll just get worse. It'll be billions and billions of dollars out of balance. We can't afford that. We have to act today. We have to act responsibly. We have to have members of the General Assembly who step forward and do important things, not just for now, but for the future and the common good of the people of Illinois. And that's really what our system is all about. Because if we don't act, our important investments in health care, as well as education, and definitely public safety, will be put in jeopardy. Because the squeeze that will come from accelerating Medicaid costs, not paying the bills, having a system that is out of whack, out of budget, out of balance, will harm other parts of our government in Illinois and harm the people of our state. So we must take this stand today. Look forward to working with the General Assembly to pass this package, a balanced package, a reasonable package. I think we can make our state a whole lot better by so doing.